Boxer dogs and eye health, recognizing and addressing common concerns. Boxer dogs are beloved pets known for their playful and energetic nature. However, like any other breed, they are prone to certain health issues, including eye problems. This video aims to shed light on common eye health concerns in boxer dogs and provide valuable information on how to recognize and address these issues effectively. Recognizing the symptoms of eye problems is crucial for early detection and timely treatment. Boxer owners should be vigilant and look out for signs such as redness, discharge, excessive tearing, cloudiness, and changes in their dog's behavior. Regular eye examinations by a veterinarian are also highly recommended to ensure the overall well-being of your furry friend. Some of the common eye health issues that boxer dogs may experience include corneal ulcers, cherry eye, and progressive retinal atrophy. Corneal ulcers can occur due to trauma or infection and often manifest as squinting, pawing at the eye, and excessive blinking. Prompt treatment is necessary to prevent complications and preserve the dog's vision. Cherry eye, on the other hand, is a condition where the gland of the third eyelid prolapses, resulting in a red, fleshy mass in the corner of the eye. Surgical correction is often required to prevent discomfort and further complications. Progressive retinal atrophy is a genetic condition that leads to gradual vision loss. Regular eye exams and genetic testing can help identify carriers of this condition and prevent breeding-affected dogs, ensuring the long-term eye health of the boxer breed. If any eye issues are suspected, it is essential to consult a veterinarian promptly. Early diagnosis and appropriate treatment can make a significant difference in preserving your boxer's vision and overall quality of life. Remember, your furry friend relies on you to be their advocate for their eye health, so stay informed and proactive in recognizing and addressing common eye concerns. Common eye health issues in boxer dogs. Boxer dogs are known to be prone to specific eye conditions that can affect their overall eye health. These conditions include corneal ulcers, cherry eye, and progressive retinal atrophy. It is important for boxer owners to be aware of these issues in order to recognize the symptoms early and provide appropriate treatment. Corneal ulcers are a common eye problem in boxer dogs. They can occur due to trauma or infection and can be quite painful for the dog. Symptoms of corneal ulcers may include squinting, pawing at the eye, and excessive blinking. Prompt treatment is crucial to prevent complications and ensure proper healing. Another eye condition that boxer dogs are susceptible to is cherry eye. Cherry eye is the prolapse of the gland of the third eyelid, resulting in a red, fleshy mass in the corner of the eye. Surgical correction is often necessary to prevent further complications and discomfort for the dog. Progressive retinal atrophy is a genetic condition that affects the retina and leads to gradual vision loss. Regular eye exams and genetic testing can help identify carriers of this condition and prevent breeding-affected dogs. Early detection is key in managing progressive retinal atrophy and preserving the dog's vision. Understanding these common eye health issues in boxer dogs is essential for their well-being. By being vigilant for any signs of eye problems and seeking prompt veterinary care, owners can ensure that their boxers receive the necessary treatment and support to maintain good eye health. Recognizing symptoms of eye problems. Owners should be vigilant for signs such as redness, discharge, excessive tearing, cloudiness, and changes in behavior. Regular eye examinations by a veterinarian are also recommended. Eyes are the windows to the soul, and just like humans, our furry friends can experience eye problems too. As a responsible owner, it's important to be aware of the signs and symptoms that may indicate an issue with your boxer dog's eyes. By recognizing these symptoms early on, you can seek prompt veterinary care and ensure the best possible outcome for your beloved pet. One of the most common signs of eye problems in boxer dogs is redness. If you notice that your dog's eyes appear red or bloodshot, it could be a sign of inflammation or irritation. Discharge from the eyes is another symptom to watch out for. Excessive tearing or a thick, pus-like discharge may indicate an infection or other underlying issue. Cloudiness in the eyes is another red flag that should not be ignored. If your dog's eyes appear hazy or foggy, it could be a sign of cataracts or other age-related conditions. Changes in behavior can also be indicative of eye problems. If your normally active and playful boxer becomes lethargic or starts bumping into things, it may be a sign of vision impairment. While being vigilant for these symptoms is important, it's equally crucial to schedule regular eye examinations with a veterinarian. Just like humans, dogs should have their eyes checked by a professional to ensure optimal eye health. A veterinarian can detect any underlying issues that may not be immediately apparent and provide appropriate treatment. In conclusion, recognizing symptoms of eye problems in boxer dogs is essential for their overall well-being. Owners should keep a close eye on their pet's eyes and be on the lookout for redness, discharge, excessive tearing, cloudiness, and changes in behavior. Regular eye examinations by a veterinarian are strongly recommended to catch any potential issues early on. By staying vigilant and seeking prompt veterinary care, you can help preserve your boxer dog's vision and ensure a happy, healthy life. Corneal ulcers. Corneal ulcers are a common eye health issue in boxer dogs and can occur due to trauma or infection. These ulcers are open sores on the cornea, the clear outer layer of the eye. They can cause discomfort and potentially lead to serious complications if left untreated. Recognizing the symptoms of corneal ulcers is crucial for early detection and prompt treatment. Some common signs include squinting, pawing at the eye, excessive blinking, and redness. If you notice any of these symptoms in your boxer dog, it is important to consult a veterinarian as soon as possible. Prompt treatment is necessary to prevent complications and promote healing. The veterinarian may prescribe medication or recommend eye drops to alleviate discomfort and promote healing. In severe cases, surgery may be required to repair the ulcer. It is important to follow the veterinarian's instructions and ensure proper healing to prevent further damage to the eye. To prevent corneal ulcers, it is important to take precautions to avoid eye injuries. This can include using protective eyewear during activities that could potentially harm the eyes, such as playing in rough environments or participating in contact sports. Keeping the dog's environment free from potential hazards, such as sharp objects or chemicals, can also help prevent injuries that could lead to corneal ulcers. Treatment options for corneal ulcers. Treatment for corneal ulcers in boxer dogs can vary depending on the severity of the condition. In mild cases, medication and eye drops may be prescribed to help reduce inflammation and promote healing. These medications are typically applied directly to the affected eye and may need to be administered multiple times a day. In more severe cases, surgery may be necessary to repair the ulcer and prevent further complications. This procedure involves removing the damaged tissue and suturing the cornea to promote proper healing. It is important to follow the veterinarian's instructions closely after surgery to ensure the eye heals properly and to minimize the risk of infection. During the treatment process, it is crucial to monitor the dog's progress and watch for any signs of worsening symptoms or complications. If the dog shows any signs of discomfort, such as increased redness or swelling, it is important to contact the veterinarian immediately for further guidance. Additionally, it is important to provide a clean and safe environment for the dog during the healing process. Avoid exposing the dog to potential irritants or allergens that could further aggravate the eye. Follow any post-treatment care instructions provided by the veterinarian, including administering any prescribed medications and scheduling follow-up appointments for reevaluation. By following the recommended treatment options and closely monitoring the dog's progress, owners can help ensure proper healing and minimize the risk of complications associated with corneal ulcers in boxer dogs. Preventing corneal ulcers. Corneal ulcers can be a painful and potentially serious eye condition in boxer dogs. Fortunately, there are steps you can take to help prevent them from occurring. By being proactive and implementing preventive measures, you can reduce the risk of your beloved boxer developing corneal ulcers. One of the most important ways to prevent corneal ulcers is to avoid eye injuries. Boxer dogs are known for their playful and energetic nature, which can sometimes lead to accidents. Keep a close eye on your dog during activities and ensure they are not engaging in rough play that could result in eye trauma. Additionally, if your boxer participates in activities such as agility training or contact sports, consider using protective eyewear specifically designed for dogs. This can provide an extra layer of protection for their eyes and reduce the risk of injury. Another crucial aspect of prevention is creating a safe environment for your boxer. Remove any potential hazards that could cause eye injuries, such as sharp objects or chemicals. Keep your dog's living space clean and free from debris that could accidentally come into contact with their eyes. Regularly inspect their surroundings to identify and address any potential risks. Remember, prevention is always better than cure when it comes to corneal ulcers. By taking these preventive measures, you can significantly reduce the likelihood of your boxer experiencing this painful eye condition and ensure their long-term eye health. Cherry eye. Cherry eye. Cherry eye is a common eye health issue in boxer dogs. It occurs when the gland of the third eyelid prolapses, meaning it becomes displaced or protrudes from its normal position. This condition is named cherry eye because the prolapsed gland appears as a red, fleshy mass in the corner of the eye, resembling a cherry. Surgical correction is often necessary to address cherry eye in boxer dogs. The procedure involves repositioning the gland back to its normal position and securing it in place. This helps prevent complications such as dryness, irritation, and potential infection. It is important to address cherry eye promptly to minimize discomfort and protect the dog's eye health. Progressive retinal atrophy. Progressive retinal atrophy is a genetic condition that leads to gradual vision loss. It is a degenerative disease that affects the retina, the part of the eye responsible for capturing and processing visual information. Over time, the cells in the retina deteriorate, leading to a progressive decline in vision. Regular eye exams play a crucial role in detecting progressive retinal atrophy in boxer dogs. During these exams, a veterinarian will carefully evaluate the dog's eyes, looking for any signs of retinal degeneration. Additionally, genetic testing can be performed to identify carriers of the condition and help prevent breeding affected dogs. Genetic testing is particularly important for boxer dogs, as progressive retinal atrophy is an inherited condition. By identifying carriers, responsible breeders can make informed decisions to avoid breeding dogs with the disease, reducing the risk of passing it on to future generations. While progressive retinal atrophy cannot be cured, early detection and management can help slow down the progression of the disease and preserve the dog's vision for as long as possible. Treatment options may include medications, dietary supplements, and lifestyle modifications to support the dog's eye health. In conclusion, recognizing and addressing progressive retinal atrophy in boxer dogs is crucial for maintaining their eye health. Regular eye exams and genetic testing can help identify carriers and prevent breeding-affected dogs, ultimately working towards reducing the prevalence of this genetic condition. Addressing eye health concerns. Addressing eye health concerns. If any eye issues are suspected, it is essential to consult a veterinarian promptly. Early diagnosis and appropriate treatment can help preserve the dog's vision and overall well-being. When it comes to the health of our beloved boxer dogs, their eyes are an important aspect that should never be overlooked. Just like humans, dogs can experience various eye health issues that require immediate attention and care. By recognizing the symptoms and taking the necessary steps, we can ensure that our furry friends receive the best possible treatment to maintain their vision and overall well-being. If you notice any signs of eye problems in your boxer, such as redness, discharge, excessive tearing, cloudiness, or changes in behavior, it is crucial to seek veterinary assistance without delay. A veterinarian will be able to perform a thorough examination and determine the underlying cause of the issue. Early diagnosis is key to preventing further complications and ensuring effective treatment. Whether it's corneal ulcers, cherry eye, or progressive retinal atrophy, addressing eye health concerns requires prompt action. Corneal ulcers, which can occur due to trauma or infection, may cause symptoms such as squinting, pawing at the eye, and excessive blinking. Treatment options may include medication, eye drops, or in severe cases, surgery. Following the veterinarian's instructions and ensuring proper healing is essential for the dog's recovery. Cherry eye. characterized by a prolapse of the gland of the third eyelid, often requires surgical correction to prevent complications and discomfort. Progressive retinal atrophy, on the other hand, is a genetic condition that leads to gradual vision loss. Regular eye exams and genetic testing can help identify carriers and prevent breeding-affected dogs. By addressing eye health concerns promptly, we can give our boxer dogs the best chance at maintaining their vision and overall well-being. Remember, if you suspect any eye issues, don't hesitate to consult a veterinarian. They are the experts who can provide the necessary guidance and treatment to ensure our furry friends live happy and healthy lives.